Now, next speaker is Dr. BNR Subudhi on role of teleophthalmology in the practice of low vision aids.
Good morning. I welcome all the fellow Ecoinians to this Ecoin session. As a steering committee chairman of this Ecoin, I invite all of you for all the conferences held throughout the year in our country by Ecoin. So in these few words, I welcome you again, once again. So my previous speaker, the three speakers they told before me, one speaker told about the blind schools. Dr. Samant has told. And another speaker told about the low vision patients. And also my friend Dr. Ajay Agrawal also has told that the low vision patients. And also he has described the low vision aids. So how to connect these three? That there are patients, there are aids, and there are blind schools. But these are not well connected. So I think teleophthalmology is the only answer for this. So let me speak something about the teleophthalmology in the practice of low vision aids. I thank AIOCMT3 giving us a good session in the prime hour of the conference and the prime day too. So I thank Dr. Namrata for giving us this session today. So epidemiology already discussed the prevalence that about age of 2020, approximately 1.1 billion people were living with the low vision. And out of these 43 million people are totally blind and 295 billion people that are moderate to severe vision. We are concerned with this low vision. Causes, already my friends have already discussed about the causes of blindness and causes of low vision. I don't want to go into details of this. So already discussed about the low vision patients existing in our country. And there are a lot of geographic variation too. Low vision blindness are more prevalent in developing countries compared to developed countries, and the causes of prevalence can vary from region to region in the same country. Age factor, majority of people are more than at the age of 50. No doubt younger patients are also there, but majority, if you take statistics, so age-related IDs are projected to increase as the global population increases. Economic impact, definitely in our country, being a socio-economical average, I would say, I won't say poor, but still these people, they definitely have a, global financial impact or financial burden. With the annual global cost of power productivity estimated around $1 billion. So these are the impact of low vision, cycle of impact, all these things lead to mainly social isolation and depression, the commonest problem with the low. They say that nothing can be done for them. So how to rehabilitate them? That's the most important. These are the low visual aids, how to rehabilitate them. So what are my friends have discussed about all these. The devices are there, but still we feel that they are not used properly by these people. So it's a comprehensive process aimed at helping individuals maximize the remaining vision, improve their quality of life in our country so that they get out of the depression. How? So detailed examination, already my friends have told about these things, I don't want to say, but therapy and training. Vision rehabilitation therapy is very important for these people and we have to train them. It should go a lot of time is required. So learning new ways to perform daily tasks, moving in a society, moving at the house. There are a lot of devices, assistive devices, adaptive techniques, supportive services. Access to support services including the counseling support groups to help patients cope with the vision loss and maintain mental well-being. Still we see that patient acceptance is very important because motivation is well required because there are a lot of really limitations of these devices, occupational demand, counseling, proper counseling is very important. Literacy of the person, most of the people are illiterate, so we have to educate them. And affordability also we have to see whether the patient can buy these equipments, whatever is available. And accessibility, whether they are accessible to these devices, if they are all patients, cities only. Are they available in the rural areas? No, they do not. So teleophthalmology comes here. It's the game changer for these low vision aid patients. So it's a matter of transformative approach in the field of low vision assessment and rehabilitation. In the coming 5 years or 10 years, we will see that teleophthalmology in every branch of science will be utilized for the benefit of the patients. So increase access to care, geographic reach. So teleophthalmology enables patients in remote and underserved areas to access low vision aids, which I told you, the rural area. They are not available them. Convenience. Patients can receive consultation from the comfort of their homes. So we have to educate them by teleophthalmology from different base hospitals. So comprehensive remote assessment, the virtual consultants are very important. Remote diagnostic tools also, use of digital imaging and telehealth platforms allow for sharing the test results and images. So the retinal scans, visual. So whatever that we test, the optometrist, simple optometrist, health worker can test these patients and they send the data to the nearby base hospital or central hospital where these are interpreted, and they can advise this optometrist and ophthalmic assistants to utilize these low vision devices. So virtual consultants are very important, and enhanced patient monitoring and follow-up, regular checkups. Once you give the, this device, whether the patient is using it or not, without finding any difficulty. So regular checkup is a must. So teleophthalmology enables regular follow-up appointments to monitor patients' visual conditions and adjust behavioral status as needed. And real-time feedback also many times through WhatsApp, through Facebook. The patient can connect with the doctors sitting at the base hospitals. So education support also, patient education is very important, because unless the patient is educated to how to use the low vision aids, it's very, difficult to use them. So the education is very important by the teleophthalmologist, can help them, education resources and training and adaptive devices and technologies, etc. And family, the patient in its familial circumstances, the family members can also help them by this teleophthalmology. Collaboration referrals, so interdisciplinary teams, so either physician, whether the other specialists like psychotherapists or psychologists, they can also be connected to the patient through teleophthalmology, not only with the ophthalmologist only. So optometrist, ophthalmologist, occupational therapist, social, all can be connected to teleopathy by virtual consultation and efficient referrals also. So technology integration, as the technology improves, newer techniques are coming up. The bionic eyes now in the horizon. Whether these bionic eyes will be available to the common man sitting in the rural area? Yes, it can be possible by our teleophthalmology. So adaptive techniques and also data sharing also. So you can have the data, which area is having more number of blind patients, which area is having this low vision aids are required. So this has to data sharing can be done to the data, teleophthalmology. So to conclude, my friend Dr. Suraj is here. Where is Suraj? So Dr. Suraj is here. I request him to do this survey and how teleophthalmology will be beneficial to them. So to conclude, teleophthalmology enhances the practice of low vision assessment and rehabilitation by improving access, efficiency, patient engagement, remote areas. That means we go to rural areas. So AIOCMT is the only association who goes to rural areas, who go to the needing patients. So we should adopt this teleophthalmology and we should connect with our specialists at the center. And as technology continues to evolve, the integration of teleophthalmology into low vision aids is likely to expand, leading to better customers and greater quality of life for individuals with visual impairments. So as Sapanda told that there are 100 blind schools in our country. I'll ask my friends here, whether in your state, how many blind schools are there? Are you aware of it? Well, I am also not aware. How many blind schools are in my state in Odisha? Sometime back I did some statistics. I collected some statistics because it's in the medical college. So during my medical college, I gave a thesis to my student to do the blind school studies. He went to all the blind schools and brought some statistics. Really, there was, and out of these statistics, we could, do some treatment to them, and also even provided low vision aids through Red Cross Society of India. So Dr. Suraj is here now. So I request you to put a teleophthalmology into this practice of low visual aids. So definitely in the coming few years, definitely it will be beneficial to all of us. So thank you very much. AIOCMT, having this year, taking the low visual aid is the source subject of interest and subject discussion. Thank you very much.
Thank you, Dr. Subudhi, for giving us information on how we can use teleophthalmology in the low vision aids. So request everyone so they can add to their practice.